The most important thing is that you get to make a difference, and that's what I love about pediatric surgery, is you get to make a difference early on that can have, a profound difference for the rest of their life.
I started noticing that her health was not in the best condition. She looked like she was 9 months pregnant at the age of 3.
I was in Korea for my job. They're doing good as far as I know, but I know I've been receiving information from my wife that my daughter Hailey, her stomach is distended. When I finally saw a picture of how distended it was, it did start to worry me.
When Hailey stopped eating, I started to become more concerned about it. I made my appointment, and the doctor decided that we needed to get an x-ray. Then he looked at the x-ray and decided that he needed an ultrasound. He specifically said, "I'd prefer if you went to LSU."
We did our own x-rays and the CAT scans of the belly, trying to visualize whether it's only in the kidney or is it involving other organs.
They had a CAT scan of the abdomen, which showed a large mass replacing the vast majority of her right kidney and occupying almost the entire right side of her abdomen and displacing all the organs out to the kind of the corners of the rest of the abdomen.
This was going to be not just a benign tumor, but probably is going to be a type of cancer.
It broke my heart because I didn't think that it could happen to somebody in my family, to my daughter nonetheless, my 3-year-old little girl. I was dreading that phone call because I know it would hurt him.
My first reaction was, to be 100% honest with you, was anger. I was angry. Why her? That doesn't make sense. Why, in the grand scheme of things, does this make sense?
The diagnosis of cancer in a child is such a scary and traumatic ordeal that we try to move as quickly as we can to try to get a diagnosis, staging, and a surgical plan so that we can get that treated right away.
Since 1999, we've had an affiliation with St. Jude. St. Jude primarily treats children with cancer.
The advantage of having a satellite clinic from St. Jude's here in Shreveport, in her particular case, if she had had to fly up to Memphis for surgery, her mom would be pretty much alone. And with Dad in transit, it just would have been a bigger stress when you don't need it.
We always consult with St. Jude, and we talk to them about every case we have to see what is the best treatment, more of getting always a second and third and fourth opinion, because we want to offer all our kids the best there is.
They said it has to come out. We have to go in and take the cancer out.
So she was going to go into surgery, and I was going to get on a plane, and then I wasn't going to be able to hear from her during that entire time, and that's about 18 hours.
Surgery on a 3-year-old was very scary. My husband wasn't there, the person who I lean on the most. But I felt confident with everybody I know saying that LSU is the best place to be going for child cancer in the area.
When you initially go into the surgery, the problem that we have is just the spatial issue. It's such a large tumor, and you're literally just taking 1 little millimeter at a time. The key to it is just to take it slow, and if you get stuck in one area and you're having a hard time, you just move to another area back and forth until eventually you get it all, out.
Getting to the hospital after I got back from Korea to be with my family was really difficult because, number one, I hadn't seen Hailey for, at that point I believe it was 6 months or longer. I hadn't seen her in that amount of time, so not only do I not get to see how much she's grown and just enjoy being with my daughter, but my first image of her was laying in a hospital bed because she had just gotten out of surgery and she's still sedated. So my biggest concern was making sure Christina was okay emotionally, mentally, spiritually, and things like that.
Seeing Jared was a relief, and I knew that Hailey being able to see her daddy was something big for her.
It's always hard to come to the parents. We have a great news that we got all the tumor out, but we have this pathology report that says that things are a little bit more aggressive than we expected. But I think in childhood cancer, always we talk about a cure. So our aim is not talking about, how many months, but mainly a cure for life. The main aim is a couple of things. First of all, with the radiation, trying to prevent the relapse of the disease back in the same area where the tumor was. As good as surgery is, there's always going to be a chance that some of the tumors may slip around the area, so that's where the radiation helped us a lot. And Dr. Wilkinson from the Radiation Cancer Center also helped us with doing the radiation therapy. And then from a chemotherapy, there was multiple cycles of chemotherapy where she would come to the hospital, come in, get chemotherapy, and then go home.
When she comes in, we have child life specialists in the clinic that helps the children deal with issues that are going on through what they call play therapy.
They know how child psychology changes over the years. They know how children think, and they may help supplement our role when we're talking to children about how do we get the concept to a child that you have an illness, that we are trying to get them feeling better. And sometimes when it's just a bad day for a child because of a complication, they'll help, play with the child, get their attention off their disease and onto something more pleasant.
When it came to telling Hailey about the medical process of it and what was going on, it was a little bit hard, but with the help of some of the medical staff, because they've dealt with this before, it was easier, so we would put it in terms that she could kind of understand.
We nickname everything. We wouldn't say, like, if you're an adult, we would say, let me access your port. But with her, it's called Buddy. So we're going to have to access Buddy, and Buddy's going to have to get a drink. And so then they understand, okay, Buddy's got to get a drink. And then we'll say, okay, Buddy's got to go now, and then we'll take Buddy out.
Hailey had long hair right before, so I knew it was coming. And this is the point where I really felt like it hit me the most. Like, she's got cancer.
That's when it really started to set in, that this is real now.
Every time she would come in, she would have a little bit less hair, but, Hailey was so adorable with her bald head. She was just one of those patients that you looked forward to taking care of. It was a sad situation for her and her family, of course, but she definitely made me love going to my job.
It's always surprising how kids tolerate chemotherapy and radiation, and she had her days when she would be tired. She had her days where she had fevers and she had to receive antibiotics. She had a couple of days where she even needed blood transfusions, but she tolerated the therapy very well. In most days you would see her running, whether when she comes to clinic she's running around, or even in the hospital, all the nurses know Hailey's in-house. She's all over the place, so she did very well.
The last day was unreal because I felt like I could finally breathe and that it was done.
It's her last day of chemo, no mo chemo, that's what we say. So we get him a cake, we get him some toys, and we have a end of chemo party.
Seeing the joy in mom and dad's face and the child that they're done, no more chemotherapy, no more, that's a meaning I could not explain, even if I tried to, but it makes me go back home and say, I helped a child feel better today, and that's what counts.
It would just hit me randomly. I would see her, she'd be doing great playing, her hair's starting to grow, and it would just hit me every once in a while, just out of nowhere, like, you made it through that, like, you went through all of that, and it's done.
It is a big team that need to work together in order to make this happen.
Hailey's a good example of how everyone working together in the community, different hospital entities, different services, can come together and really make a difference in the life of a patient, especially a child.
My job is very rewarding. For over 20 years, I've had the opportunity to see children get healed from cancer. So when I see Hailey running around, little cute little little baby girl, you would not think that she's been through what she's been through.
Hailey today is a very energetic, happy, glad to be here little girl.
Going through this, you now realize you don't always have the future. So I try to make the best of it here and now, and I am thankful. Looking back, I'm thankful for all the people that we had. I mean, from the bottom of my heart, I thank you for taking care of me and my family, my wife, when I wasn't here.
I tell all the nurses and doctors and everybody who helped out with Hailey and her treatment, I appreciate everything they did to help her get past this and to move on in her life. I don't know what I would do if I didn't have my little girl.
The best thing would be to imagine, decades from now, Hailey sitting on a porch with her grandkids around, and they're asking her about her childhood, and she lists off 100 different things, and she goes, oh yeah, by the way, I also had cancer. That to me would be a happy story, and that's what we like to see.
Say thank you. Thank you.